Pharmacy plays a significant role in the patient care experience when they're hospitalized here at Houston Medical Center. Our roles are multifaceted, but key amongst them are medication management practices. We ensure from the time the patient arrives to our facility to the time that they're discharged that the use of therapy, drug therapy that is appropriate for them, that it is collaborative in their scope of care, and it also focuses primarily on their individualized treatment. One of the most unique aspects of what we do as a profession is being a part of all drug therapy. I mean, from beginning to end, we are involved in all aspects of drug therapy, from the time that the patient arrives throughout their stay, with continuous improvement quality measures by assessing the home medication list, looking at their drug therapy as their orders or profile, and also doing transition of care. Our pharmacists have been involved in ensuring that at discharge that we are available to provide drug information for patients as they transition from our services back into the community. So having the ability to have our hands in all aspects of drug therapy ensures that we are seen as an integral part of the healthcare team. On any given day, we have anywhere from 10 to 15 pharmacists, and we also have approximately 15 technical support staff that includes our certified pharmacy technicians. Our pharmacists look forward to working very closely with our doctors and our nurses, and as well as it provides us an opportunity to be seen beyond dispensers. In fact, we are part of the team, not so much so for dispensing, but improving efficiencies, also improving patient care experiences, and making sure that pharmacy services are recognized beyond the four walls of the pharmacy. And it goes back to why it was so important for us to be decentralized. Our physicians like knowing the pharmacist, seeing the pharmacist, having the pharmacist available to them in person as opposed to over the phone. It's important for our pharmacists as well as our technicians to understand that when an order is processed, that it has to go through many phases to ensure that the label is appropriate before it's dispensed to the patient. So technology plays an integral part because not only do we have to embrace where healthcare is going with the adaptation of technology, but we have to clearly understand how important it is for us to incorporate those changes in our daily workflow. Oh, I have the fantastic opportunity of working with some very dedicated healthcare professionals. And when I say healthcare professionals, I mean not only within my department, but within the organization. My team, which includes not only the pharmacy staff, but our nursing staff, our providers, and our leadership, ensures that the work that we provide to our patients is supported in evidence-based medicine. We are very compassionate about the services that we provide to our patients, very involved, very team-oriented, and most importantly, we embrace collaborative work. Home medication list is a very important aspect of patient care. I would encourage any patient who is seeking medical care to keep an up-to-date, concise, appropriate, and accurate home medication list. That information is utilized from the time you hit the door. It is assessed to ensure appropriate continuum of care, and it allows for pharmacy and your medical providers to get a clear picture of your healthcare experience. Houston Healthcare is investing in the community to ensure that when patients leave, that they have improved healthcare outcomes. We are also invested in the community to ensure that the services that we provide at Houston Healthcare extend beyond the four walls of the organization. For example, we have a lot of programs outside of the organization that are directed at the community education about medication therapy, our heart failure talk, ensuring that we are available for Diabetes Day when it's held annually in Perry. Pharmacists are involved in that process. We are available for our patients who are discharged with diagnosis of heart failure to ensure that we reduce the opportunity for unnecessary readmissions by being available to discuss with them their drug therapies as an outpatient. So I would have to conclude with saying that medication management is one of the key things that we do at the hospital to ensure that our patients are safe from the time they enter the door to the time they're discharged.